So for this particular procedure, we have got a mosquito just to localize our area of interest. This is some local anesthetic that we will give to make this procedure as pain-free as possible. This is a 22 gauge spinal needle. This is an omnipaque dye to confirm our position, and this is 10 ml, which is a mixture of 80 milligram of depomedrone, which is 2 ml, and then we have 8 ml of 2% lignocaine. So this is what you will need for this particular procedure. So of course it goes without saying that this procedure has to be done under all aseptic or sterile precautions. So we have painted this area, we have draped this area, and I'm going to feel for the sacral cornua, and this is the left side and this is the right side. So when you have gained enough experience, you should be able to feel this pretty much straight away. On a thin patient it is very easy. On a patient who is slightly obese, then it can become quite difficult, and then you can use your C-arm to localize that position. So I feel this is the cornua, so I'm just going to put my mosquito there, and then we will take a C-arm shoot to confirm our position. So keep your artery at the level where you feel or you believe that the cornua is, and then take a lateral at this particular position, and then I will show you how it will look on a C-arm image. So if you look at this image, this is the prominent bit that you will feel, that is the cornua, and this is the sacral hiatus. So this is the area which we are going to anesthetize. So the next step will be to put some local anesthetic so that the procedure becomes less painful or pain-free. So once you have localized your area, so just give some local anesthetic to make this procedure as pain-free as possible. And I will give some local anesthetic, and I will wait for a few minutes, and I will join you with the next step. So once you have localized your area, your initial insertion will be at an 45 degree. So you just enter at a 45 degree and you check the position under the C-arm, and if you are in the right spot, then you slowly lower it and then pass it into the canal. So if you look at it, my entry point is pretty good. I'm just on tip of the cornua. I have just made my needle slightly less than 45, and I will ask Prashant to show how I make it horizontal and how I go into the canal. So my angle was 45. I'm just gradually dropping it. Now I know I'm in the right position, and I will keep on making it horizontal. And this seems as if it is in the right spot. So let's look at the C-arm. So you can see now we are in the right space. So we started like this at 45, and then we gradually became horizontal and then went inside. This is the space that we are talking about, and the needle looks in perfect position. So I will show you how the needle looks when it is in the right space, and then next step will be to inject omnipaque. So you can see we entered in this position, and when we want to enter into the correct space, this becomes almost parallel to the body. So this is the correct position. So next step will be to take this out and inject some omnipaque, and then check it under the C-arm to see if you are in the right space. So I'm just going to take some omnipaque, and then I'm just going to inject just few milliliters, and then we'll take a shoot. So now you can see our needle is parallel. This is the dye. It's nicely flowing in the epidural space. You can see this is following the roots. So the next step will be to take an AP view, and I will show you how it looks in an AP view. You can now clearly see on an AP view that this is in the right space. We have checked it on the lateral, and this is going on each side. So I have not injected a lot of dye, otherwise you will see a typical Christmas pattern view on an AP view. So next step will be just to inject our mixture of depomedrone, and so if you're in the right space, it should flow freely. See, I'm not using a lot of force. Just go slow, and then it will flow freely. If it is not flowing freely, even if you're in the right space, that means you are very close to the bone. So just withdraw it a bit and then keep on injecting it. So it should flow extremely freely, and this is how you do it. And you can see that we did this procedure under local anesthetic and patient did not experience much discomfort. So you can do it under sedation, but if your local anesthetic, if you want to do it under local anesthetic, you can do it without any problem. So this is the end of our procedure. So this is how you do a caudal epidural injection.